Guess we'll get started. Good afternoon, everyone, South Florida HIMSS members and guests, and thank you for taking the time out of your workday for this really exciting Burnout in Healthcare Environment panel discussion with industry-leading experts. I am Nicole Bramblett. I am the co-program chair alongside Grant McCall, and also the client relationship manager for Scribus, which is a medical scribe, as well as a non-clinical support staff company which supports healthcare systems and large medical practices. Just a few housekeeping items. Please be sure to turn on your cameras so we can all interact with each other, and stay muted as the presenters are speaking. We will have time at the end of the webinar for a Q&A, but feel free to also use the chat box option to put any questions that come to mind, as well as if you want to network, put in your LinkedIn info on there as well. Also, the webinar will be recorded in case anyone needs to jump off early. Now I'd like to introduce Oscar Perez, our president of the South Florida HIMSS.
Thank you, Nicole. You guys can hear me okay? Okay, great. Well, good afternoon, everyone, and thank you for joining. We have a great panel discussion today on a very relevant topic in our industry, and we've got some great speakers for you today. And I'll introduce the moderator in just a bit. But before we get started, as many of you know, my name is Oscar Perez. I'm the Vice President of IT at Memorial Healthcare System and also the President of South Florida HIMSS. If we go to the next slide, Nicole or Ryan, whoever's driving. Before we get started, we also want to thank our sponsors. Without our sponsors, we wouldn't be able to bring some of this great and awesome educational content to you all at no cost. And so we'd like to thank KPMG, Fortinet, Nutanix, E4, Dell, Connections, CDW, and Pure Storage. We also have, if you go to our website, we've got a great amount of content there and upcoming events that we've got coming up. You know, as I said, we try to keep the months and the year packed with events that bring value to all of you, our membership. And so we've got a couple of great events coming up. We've got our yearly student event coming up in April. And if you go to our website, you'll get more information on that. We also are going to be asking for nominations for new board members, as some of our board is going to be falling off. So if you're interested in participating in the board or getting more engaged, please contact any of the board members directly, and we can get you involved, whether it's through committees or whether it's through eventually becoming a board member. So we're a very active board here, and we try to strive to bring the most value to our membership here in South Florida. So we also, besides the student event in May, we're planning our golf event, and this is going to be our first in-person event since the global pandemic started. So we're very excited about that. We plan to do that safely, and there's information going to be coming out in our website for you all to register soon. So please join us for those events. Having said that, if we can go to the next slide. I'm going to hand it off to our moderator, but I'd like to introduce our moderator before we get started. We have, a great panel discussion today with Ryan Summers, Dr. Fernando Mendoza, and Jesus Diaz. Ryan's going to be our moderator today, and Ryan is the director of Epic Practice at Healthcare Triangle. Ryan has spent the last 20 years working with organizations in both acute and ambulatory settings to strategize, plan, and deliver EHR and related technology projects. His work has spanned the clinical, patient access, and revenue cycle domains, where he led implementation, optimization, and assessment and advisory initiatives. He has spent significant time working with clinicians and translating their desires for efficiency in EHR over to IT. So he makes the great moderator today. He presently leads a team of Epic-focused resources and continues to advise and assist organizations looking to improve clinical operations, EHR efficiency, and clinical satisfaction. So without further ado, I'd like to pass it off to Ryan. Ryan?
Thanks, Oscar. And to set the record straight, I do have a significant Epic background, but we are not focused on Epic today. So this will be a completely agnostic conversation. I've got some targeted questions keyed up. We'll talk about way more than just EHR. So appreciate the introduction and really look forward to turning over to Oscar and to Dr. Mendoza to really share what's going on today and their experiences with their peers around the state of burnout and all sorts of items as they relate to the EHR and as they relate to operations. So without further ado, let's get into it. Dr. Mendoza, Jesus, do you want to quickly introduce yourselves?
Yeah, hi everybody. Thank you for joining us, and thank you for HIMSS for having me. And it's great to be here and really touch on this really important topic that affects, I think, everybody in healthcare, not just physicians, but nurses, techs, administrators. Everybody is affected by this topic of burnout or moral injury. My experience is I'm a pediatric ER physician. I'm actively practicing in South Florida, and I'm a founder of Scrivus, a medical scribe and non-clinical support staff company that is founded here in Florida.
Awesome. Thank you, Dr. Fernandez, Dr. Mendoza. My name is Jesus Diaz. I'm currently a director of nursing informatics here at Memorial Healthcare System. I'm a registered nurse by profession. Spent most of my nursing career in psychiatric and behavioral health inpatient areas, and the last 3.5 years joined the informatics team here, connecting with the organization wide. I also would like to thank everybody who has contributions into the healthcare landscape and beyond. This has definitely been a difficult time for everyone over this past year. So I'm super excited and humbled, to be able to connect with everybody here, talk a little bit about experiences and some of my perspectives, as I'm sure I share them with you as well. So I look forward to the discussion.
Thanks, Jesus. Thanks, Dr. Mendoza. So I'm going to quickly set the stage here and kind of frame our conversation. Just to level set here, we're going to do a real quick definition just so everybody is sort of on the same page and understanding what we really mean by definition when we're talking about burnout. So really quickly go through what that means, both from a personal and professional standpoint. We'll get into some of the tools, available industry best practice tools at the end of the conversation today. And really we want to dive into what are the opportunities for intervention, what are what can we all be doing in the day-to-day to make things better for those around us. So context, I'll throw up a whole slew of headlines. These come from notable organizations doing studies. You see some articles here, Why Doctors Hate Their Computer, for Dr. Gawande. Just let you take in what's on here to sort of frame why we're even having these conversations, right? And it's been occurring in the last 5 years, longer than that, but really has gotten acute focus over the last 5 years. So you see everything from dissatisfaction with the computer to the EHR impact that we've all seen has grown over the last decade. The stats on clinician suicide are off the charts compared to other professions, other industries. So that really just kind of shows why we're here and why we need to continue having these conversations. Defined. So when we talk about burnout from a true, what does that mean? I think everybody has an understanding that there's a certain level of overworked, overcommittedness. But burnout by definition is psychological in nature. So it comprises exhaustion, cynicism, and inefficacy. And it's chronic. It's not just an acute one-time sort of experience. It's not just that you were pushed over the top. It's that people have been building this up internally for a long period of time. It's chronic and continuous. It's not a one stage experience that you can get over. And those three components there, emotional exhaustion, depersonalization, and low professional accomplishment, really are what the industry standards say we roll around the meaning of burnout. So that feeling of being overwhelmed, stressed, lacking the capacity to perform at the level that you want to or need to. Depersonalization, so we often see that folks will dissociate from their peers. You will be cynical. You will detach from your job core responsibilities, and that can manifest in personal relationships as well. And then the professional accomplishment, so feeling inadequate. From a clinician standpoint, this is most clinicians get into healthcare to be service providers, right? They care about the patients and the experience that they're providing. And that's lost when you get to the state of burnout. So those three things are really the pillars of what we define as burnout and what individuals lose or have to deal with when they get to that level. throw up a few statistics here, and then we'll turn it into some conversation. So right now, these come from the latest studies and surveys out there from Mental Health America, from Medical Economics class, and a couple other surveys. But 93% overall healthcare workers, and that's across roles, are stressed, not truly burnt out by definition, but stressed, and that's extraordinary. 76% are at that level where we sort of dictate that they're past just being stressed, and they're experiencing true clinical burnout measures. On the provider front, for years, we've been around the 40 to 70% mark of physicians self-reporting at least having symptoms of burnout. And you see they're 91 throughout their career at some point have felt that they're at the level of burnout. On the nursing front, Jesus will talk to you, but 25% now are self-expressing or reporting symptoms of burnout. This is, I think, over the last year, really, nurses have got a lot more attention. There haven't been a lot of statistics and studies out there on the nursing front, but that is definitely gaining, and we're now seeing that pick up as well. 45% report that they do not have adequate mental and emotional support from their organizations and from their peer groups as well. So all factors that are contributing. All right, we talked a little bit about the suicide rates, and again, this just sort of sets the stage for why we're here having these conversations. 13% of physicians specifically have thought about it, contemplated it, have active thoughts. So just sort of absurd in terms of the range that we're speaking of there. And here you see the impacts. So I'll really quickly let everybody kind of take these in. 5 to 10% increased chance of major errors occurring when your provider is at the state of burnout. 43% chance that they're going to put in reduced clinical effort compared to what they would otherwise. 2 times the amount of professionalism reduction, patient-reported dissatisfaction. And then, no surprise, but we're seeing shortages of staff on both the nursing and the provider front, and that's just growing. So over the next decade, you see there are 100,000 MDs we're expecting to be short of. Nursing has been, we've had a national shortage of nursing for a long time. So those problems are continuing. And with that, I'm going to turn it over to Dr. Mendoza and let him have a chance to provide us some direct input. So Dr. Mendoza, I've got a few stats up here. Specifically that highlight from the provider front, self-reported sort of stats on their level of frustration, the errors that they do make, the impacts that they're having when they reach that level of exhaustion and burnout. But I'll turn it over to you and just let you kind of give your introductory perspective here.
Okay, great, thanks. And I failed to mention in my introduction that I also founded a pediatric ER practice here in South Florida, and currently a medical director for the pediatric emergency room at Baptist Health. So my experience is not just as a bedside physician, which I still work clinically, active shifts, but also with recruiting and retaining and managing physician group. And although, all this discussion we're having here and any discussion you have in healthcare today can be painted in kind of a pre and post COVID era. A lot of this, obviously, a lot of these issues we're talking about today were exacerbated by COVID. So I don't want to, we can talk about pre and post COVID or pre and during COVID, but this was something that's really, really at the front of a lot of leadership and physicians' minds, in February of 2020 prior to COVID. So you were kind of picking up where we left off, and I think COVID kind of magnified the issue a bit. Although there was a lot of real, kind of work satisfaction by physicians and allied health professionals and nursing during this pandemic, be able to provide great care certainly was a big stressor. I think this slide's really interesting because, having, been doing pediatric ER for about 20 years now, I guess I'm a Generation Xer by definition, born without, a cell phone in my hand, but now I can't live without one, right? Born before, we had instant messaging and all that kind of stuff. But, what's interesting is that even generationally, burnout or emotional exhaustion or moral injury, it doesn't really matter what generation you're from. There may be different reasons for it. Gen Xers certainly are looking for, they grew up and kind of helped create, the Jeff Bezos and the Bill Gates. I don't know if he's quite a Gen Xer or not, but creating technology, the Twitter founders, the Facebook founders, those are people who have created technology. We want the most out of technology, but we get really frustrated with our inability to make an effective use of it and getting to the job, getting to your work and getting your work done and seeing technology where it's really effective in other areas, in other industries, and being seen as almost as a barrier to providing great care. Boomers, been there, done that. I've seen, really married to medicine and looking at this problem is, well, why do I have to adopt this now? Although most boomers are really, really technically savvy when it comes to mobile devices, when it comes to the exam room or to the hospital, it becomes a real challenge for most boomers. So they're looking back to him at the end of my career. I'm in the last phase of my career. Why do I have to take this huge new challenge? Help, I'm drowning with this. Millennials, on the other hand, it's really interesting. We're recruiting new physicians. They embrace technology. They're creating technology, and the frustration is there. I can create it. I have an app for that. Why is it so difficult to get from point A to point B for me? And by the way, I don't want to be burdened by this technology. I don't want to have to sit at home and do charting or after hours and do charting or, really not get done what needs to happen at work. When I get home, I want to do X, Y, Z. I'm not defined by it's interesting, not being defined by being a healthcare provider, by being a physician. I'm defined as a rock climber, an adventurist who happens to be a doctor. So it's a different perspective, all reaching toward the same goal or the same problem, which is doctors are not getting time in front of their patients. They're not getting that face-to-face contact, and they're really being burdened by the technology that's put in front of them.
Yeah, thanks, Dr. Mendoza. And we'll display some of those stats as well. I think really well articulated there that 3 completely different experiences in their career all manifest exactly the same nowadays with the technology we're faced with, and we'll show a large part of that is the EHR, but it's not just that. Jesus, I'm going to turn it over to you now and comment on some of the nursing impacts. And Jesus, if you also want to comment just a little bit from your perspective on how COVID has, accelerated or changed some of what you've seen on the nursing front as well, I think that'd be phenomenal to hear.
Sure. Yeah. No. Absolutely. This is such a big discussion that it's difficult to cram it in, to an hour. But I will try and do it justice. I'm sure Dr. Mendoza can agree. But first, I'd like to just recap, right? So COVID has and will continue to have a lasting impact, right? Initially, COVID caused stress worldwide due to the unknown, scary nature of what was happening. And now it's causing stress because of the known nature, however, the unknown time frame, right? This impacts all care team members. And I would say, all persons in the community as a whole, right? Because this is an ever-evolving scenario. Think about it, right? A little bit over a year ago, the unmentionable happened. Our world stopped functioning as we know it. Lockdowns swept across our nation. Food and essential items became scarce, right? In the United States of America, no one would ever think that. We even had a toilet paper shortage for no apparent reason other than, people undergoing mass hysteria and chaos, right? Causing this issue. And that's just regular folks like you and I. That's not to mention healthcare workers, who were at the center of it all. They've had to change, to adapt quickly to changing demands and operations, dealing with the new norm of death and dying, which is something, that's very, very impactful. Dealing with staffing shortages. You mentioned that, and we're going to get into it in a little bit. Wondering if they're going to have enough PPEs. And this isn't, fortunately. And, from a nursing perspective, I think there's a few drivers that are worth mentioning here because it's really impacted different roles differently, right? To name a few, the informatics team member, right? They've had to, as if things aren't difficult enough, they really had to adopt a changing directions on a dying mentality, as new technologies, programs, demands, and challenges were faced in the COVID era. Informatic team members really had to adapt, reprioritize, and find solutions quickly, right? While keeping in mind that we still want our healthcare workers working at the top of their license. We don't want to introduce new workflows that are going to further take them away from the bedside, as Dr. Mendoza had mentioned. So those are all very real challenges. You know, you look at the EVS worker, you know, they've seen a tremendous shift in how their efforts have had a tremendous focus and impact on the overall care team's efforts, to include wearing full PPE while performing their regular tasks. You have the nursing leader, you know, struggling to keep their team together emotionally and physically as they navigate through the staffing challenges and the rise in patient acuity. You have the finance leader, and I'm kind of going through the various roles in the healthcare setting, but you have the finance leader who's trying to make sense of the loss of revenue while understanding this is happening across the nation. And then they have to become resourceful, you know, with the new programs, technologies, and requests that are coming through in the COVID era. And lastly, you know, you have senior leadership and healthcare organizations that, you know, in the role that they play in assuring the workforce, communicating and letting them know, hey, we got this. We are going to get through this together and create a better path forward. You know, so nursing, you know, has really, like Dr. Mendoza mentioned with physician, nursing has really been at the forefront, has seen a tremendous impact. Burnout is very real. It was creeping its way up before the pandemic. The pandemic definitely elevated everything and really pushed a fast forward button on many things, some good, some not so good. So we're going to get into discussion here, but yes, nursing has definitely seen a tremendous increase in burnout, and that ranges from individuals leaving the profession, retiring early, not being as effective, you know, subscribing to those 3 points that you mentioned initially. And I just want to, before we move on to the next point, I just want to say it's okay to experience all those things that you mentioned previously, right? The depersonalization, not feeling effective. It's okay to experience that. We're only human. We have to make the best of it. We have to be resourceful. We have to lean on each other. So I'll leave it there. We'll move on. But I think it's important to note that everything that everyone is experiencing, we're all experiencing it together. And it's right now it's our norm, and we have to best manage to get through this together.
Thanks, Jesus. That's great recap. I don't think just looking at the headlines and the stats necessarily do it justice. I think that's I really appreciate the perspective from a number of different resource types, all the way from your frontline workers to organizational leadership and how it's impacting and what they need to be thinking about. Curious from both of you right before we move on here, and we definitely will get into some of those key impacts both in terms of EHR and non-EHR, more organizational, but on the front of, you see here, nurses are moving more into informatics, the provider informatics as a sort of service line and a group has been coming into form for a number of years now. Do you guys have perspectives on what informaticists can do or should be doing or are doing to help in this arena?
Yeah, so sorry, go ahead.
Go ahead, Jesus.
Yeah, from a nursing standpoint, I have the privilege of preceptoring informatics students at Memorial, right, that have interest or in a master's level informatics program, so they want to get exposure into the field. And I can tell you that we have a steady stream of requests of individuals, entering, both folks who work currently in Memorial and in the community. And yes, there definitely has been a tremendous increase in impact, and for various reasons, right? People sometimes don't understand fully what informatics does, what IT does, and it's all encompassing. I mean, there's so many different areas within an informatics program, but it probably has to do with, they've been a frontline staff member who has likely seen some inefficiencies in either the EHR or a process, and they want to break into that field to lend their expertise in hopes of creating that more seamless workflow, or creating a product that has that extra clinical touch to make sure we're developing tools that allow, again, providers and clinicians to work at the top of their license. I can tell you that at Memorial, our informatics team, I think we've done it right, where most of our folks are practicing clinicians. That includes doctors, nurses, respiratory therapists, pharmacists. And what that brings to the team is not just book smarts, right? It brings real life practice knowledge that we can supplement discussions, inform ourselves, and really collaborate again with the clinical leadership and have a great discussion to say, hey, this was my experience. Is it still this? Or just have a different perspective, but really have a seat at the table and round out that experience. So yes, we're definitely seeing an increase in informatics, and that's a great thing because again, folks want to share their knowledge and really make an impact in the field.
Thanks. Dr. Mendoza, I'll turn it over to you for your thoughts here. I'll kind of move through the slides as well, and we'll start to get into some of the EHR specific. I know you've got feedback to share on your journey with EHR, but love to hear your thoughts around informatics. And
I want to echo what Jesus says. I mean, really resoundingly, I think, additions to the team when it comes to informatics, nursing informatics especially, everybody in the team here at Baptist Health, and in my experience, it's been a welcome team building. Having frontline experience is integral. It's crucial to being effective as an informatics member. I mean, when nurses and doctors are working within the system or on a system and understand the perils or kind of the trials and tribulations, they really bring an effective solution, kind of based approach to what's happening and how to implement that. So in my experience, we've gone through a couple of big go lives, people that I lean on, people that really are effective, people who've been at frontline. You have, kind of outside vendors that come in and bring some informatics individuals in who don't have frontline experience, basically not very useful. We've seen an increase definitely in the staffing and the investment from our healthcare system with the informatics individuals, and they've been really, really great. I will also echo that, probably less physicians are getting involved because it takes away from the clinical time, but the physicians that can marry both, and every healthcare organization has physician leaders who will step up to that role. Those are really effective individuals as well. So I think having frontline nursing experience, frontline physician experience really allows physicians and nurses at the bedside to engage and have a voice and be heard, which is really important in the burnout picture. Having engagement and having a voice is really important to affecting change. And that's, one of the biggest, I think, solutions for burnout. And I will step back to your previous slide. So 91% of physicians say at some point have experienced burnout. I mean, I would be lying to you if at some point in my career, or even several times a year, I don't even take a step back and change what I'm doing and figure out how to really get through that barrier. But everybody, I don't know what the 9% are doing. Those physicians must be superhuman, because everybody at some point is going to experience some level of burnout. Engagement and having a voice is really important. Having that frontline staff really have the IT informatics staff having that frontline experience or hands-on experience is crucial to having a successful informatics department.
Yeah, thank you, Dr. Mendoza. And you see these stats here, these contributors. This has come from Medscape's survey. They've been putting out a national survey specifically from physicians, I think, for years now, and the same items that contribute have come to the top. But you see there the lack of respect and conversation and dialogue, the lack of control and autonomy have been up in the top 5 ever since they started putting surveys out. So I think that role of having a seat at the table, having healthy dialogue, having a voice for change is still paramount in tandem with the bureaucracy and the administrative items that come with an EHR and the role and regulations today. So. All right, let's talk a little bit more about the EHR then, and then we'll move on to kind of organizational. What other avenues do we have to improve the state? So 9 out of 10 people surveyed, and this is physician specific, but I think I'd be willing to stake my reputation on that. This is not just physician centric. I think everybody would agree that the EHR contributes to what we just saw there, the administrative burden, the extra time that physicians are spending in office during the day, after hours, and nurses too, right? So nurses have a bulk of that documentation. What can you guys comment on your experiences with the EHR, what sort of a burden and challenge it has been at your organization, what you've done to combat that, and what opportunities you see around the EHR or to circumvent some of the difficulties that it poses?
Yeah, I'll jump in first and then hand it over to Jesus. Well, listen, my role is I wear a couple of hats, right? One of the hats I wear is the CEO of a company called Scribus, which is a medical scribe company, which I founded in 2014 because I took over an ER and I was spending time, 2 hours, an hour and a half every shift doing documentation, and that was making me really unhappy. I mean, I didn't want to do that. And doctors, across the country and across the area were asking, how can I get this help? So medical scribes, whether in person or virtual, really helping kind of facilitate that documentation need so you can spend time sitting in front of the patient and doing what you love to do. That to me was huge. I don't think any EHR company, and whether it's Epic, Cerner, Allscripts, Athena, is ever going to sit there and say, hey, our EHR is perfect. But by the way, we need you to get, either medical scribes or an assistant to help you do it. They're not going to advertise that. But the truth of the matter is, there's always going to be updates. There's always going to be upgrades. There's always going to be new releases coming out. So you're going to have to keep in front of what's happening. Most doctors, and nurses, I mean, they're all in it because they want to be with the patient and see the patient, take care of the patient. But, it's not the only thing. I mean, there's processes also that affect, burnout, having a voice and how you deal with, certain workflows in your office or in your practice, that all affects burnout. But I would definitely say EHR, having a solution to facilitate that is important. And all the major EHR companies, for example, have realized that, what we say at Scribus is healthcare is human care. So if you can't get to your patient, if doctors and nurses can't get in front of the patients face to face, then something is missing. So sometimes you have to invest in some human capital to facilitate that. So that's where I'll leave it.
Yeah, Jesus, anything to add?
Yeah, so we're fortunate. Our EHR implementation, we're about 10 years mature, 10, 11 years mature, so it's not to say, like Dr. Mendoza said, that we're perfect. We're probably in a better place than some organizations, but we have our challenges. And we have a continuous dialogue with our end users. We have several technology informatics focus groups throughout the organization, from nurses to frontline, from nurse leaders to frontline nurses to physicians to specialty groups that have bi-directional conversations monthly, with keeping in mind workflows. How many clicks it takes to do certain simple tasks, right? Because on the survey you mentioned, that was one of the things. Why does it take X amount of clicks to do something? We're not gonna just write it down on a piece of paper, be done with it, and that's it, right? So that's a constant struggle. So these are all things that we keep in mind, right, as we're implementing new things, as we're reviewing new things or adjusting, keeping that top of mind. I can say it at Memorial, to reduce burnout in the COVID era. We were able to take certain measures, such as adopting a disaster mode with the disaster mode documentation navigator, within our EHR, which essentially reduced the required documentation elements for admission, for shift assessments. And we did that across, again, we heard our clinical leaders ask, what can we do? We evaluated it and we provided a solution. Again, it's a disaster mode documentation, which means it's during a time of need, so it's for a defined period of time. But that allowed a little bit of breathing room for that bedside nurse to be able to spend more time with the patient, to be able to have a little bit more downtime to regroup, while still meeting, all the regulatory, financial, organizational preferences that an EHR kind of gets tied up in. So that's something that we were able to do, to kind of trim the fat a little bit during this time frame, help out the frontline staff a little bit. There's a few other things that we've done to leverage our EHR. One of them was, early on when this happened with the COVID, through last summer, we were able to administer over 100,000 COVID tests to the community, not within our hospital, to the community at a local park. We did that through leveraging our EHR and automating the process. So from scheduling through specimen collection, again, through our EHR. And now we're engaged in, having administered over 60,000 vaccines. I'm actually at the vaccine center today, and I stepped away, administering over 60,000 vaccines, again, to staff and community members through leveraging our EHR, from scheduling through the administration. So we're definitely leveraging anything that we can to take out the manual process of delivering care. Sometimes, yes, that might be a little convoluted, but in the overall scheme of things, it's definitely provided us some efficiencies, especially over this last year.
Great, appreciate it.
Yeah, well, go ahead, Ryan.
No, I was going to say I'm going to jump through a few more of the stats around the EHR, and then we can transition over to some of the non-EHR related topics and conversations and important points to mention. But I appreciate all of that background, Jesus. I think you tied, what can and needs to be done around the EHR with the rest of the operational goals and challenges just on a day-to-day basis with or without COVID in mind. So just to kind of reiterate, the EHR now is almost 50 years since they were originally formulated. So, the technology that we have today, I think Dr. Mendoza, you mentioned, using scribes because nobody in this day and age wants to spend 2, 3, 4 extra hours just, manually doing all that manual work, documentation, right? So I think, one of the big takeaways is we still need to do more, whether it's the vendors, whether it's the organizations, IT shops, whoever, we need to do more to automate and improve the EHR and the technologies around us so that we don't have to spend all that extra time. Otherwise, the need is to get that time off your plate via scribe or somebody else. So we're slowly getting there, but it still needs to be a priority. You see here some of the statistics from a physician perspective. Again, 50% of their time is spent just working in the EHR and doing all that desk administrative work. 27% of time with the patients, which you talk to any doctor and I don't think they'd say that's a number they want to, they want to do. They want that up closer to 100. More stats on the EHR here, just coming from actually a HIMSS partnership survey this year, late last year, on EHR effectiveness. So it just highlights the fact that there's so much more opportunity with the technology now available in the EHR, and we need to continue to work to hone that in. All right, we'll jump in here. Dr. Mendoza, I'm going to ask you to speak a little bit more about what can we do outside of the EHR. So these slides, Jesus, I think you talked to a lot of this, the number of clicks, what can you do there? We talked about informatics and their role, implementation, all these other features that we can continually work to improve. But what are the other components, technology or organizationally, apart from all the money that's been spent on the EHR and the continued work we need to do? What else is there? What are the pieces that need attention today to really move the needle on burnout?
I mean, one of the continued improvements is to give your physicians and your physician leaders a voice, and especially staff physicians or nurses. Give them a voice to voice their concerns about how the workflow can improve. It's not all electronic health record. I mean, that may be kind of an anchor for a lot of the complaints, but the truth is that, if you click on EHR and on an order or something like that, and it goes to a nurse and he or she doesn't see it in the order, and the physician gets frustrated because the order's taking a while. I mean, that is EHR related, but it's really workflow. It's really dependent on everybody's clinical scenario in their emergency department, in their outpatient setting, wherever they are. So having a seat at the table to figure out how to improve workflow and processes is really going to be, I think, kind of give returns on investment in terms of satisfaction and engagement with the providers. Another thing we cannot ignore is it's not just about the technology. You really, the institutions, organizations are in a place right now where they're investing, pick whatever EHR go live you've been in with, 10 years, 7 years ago, how many tens of millions of dollars were invested. You have to invest back into the providers with, mental health services, techniques to help with, stress relief, whether it's meditation, offering, free counseling services. In spite of COVID, there's still everyday healthcare stressors about, the severity, or not the severity, but the kind of the magnitude of the work that healthcare providers do. Really having that investment in the non-technology aspect, giving physicians and nurses the ability to de-stress, whether it's peer group counseling, whether it's, investing in, again, mental health services, whether it's investing in, outside, activities for physicians, for healthcare providers that really help them de-stress. That's really important as well.
Yeah. Jesus, what's your perspective? What has your organization been doing on the peer front, on the nursing front for that emotional, personal commitment to improving well-being? What have you seen? What's been effective? What are you working on?
Yeah, so in addition to the standard, resources that organizations provide their employees, such as EAP and such, I think our organization has done a great job communicating, right? Sometimes the unknown can drive you bananas. Our leadership teams have really, on a weekly basis, whether it's nursing, senior leadership, has really done a great job to say, what's the current state of the healthcare system? That could be from reporting, current COVID in the area, to how we're responding to it, to how we're treating it within the organization, what's our supply on hand, quantities and such, all things that are creating anxiety. They're having answers for us. So I think they've done a great job about that. From a communication standpoint, I think that, they've done it right where they've shared a lot of success. They're acknowledging the issues, but they've shared success. And that looks like celebrating, how many patients, we've been able to transition from the hospital setting to home, how much staff we're able to promote them and have continued growth, within the healthcare system, and sharing the successes, whether it's the COVID testing, whether it's the vaccine, how individuals have been able to pull resources together, to get over this huge hurdle that we've been faced with over this past year, and just communicating, and it's been very positive in nature. Frequent reminders. We have an integrative medicine program that deals with meditation and such, more of a holistic approach. They have weekly offerings that they offer to the entire workforce. It's up to you to take advantage of that, but they have it out there, and in today's day and age, we got to pull all the tools out of our tool belt, to deal with what's happening, what continues to, and what will continue to be, for the foreseeable future. So I think our organization has found a sweet spot in really providing, multiple avenues, because not everybody subscribes to the same coping mechanisms and such. But I think they've done a pretty good job in providing tools to our resources while acknowledging, hey, we have staffing shortages, still coming into the hospital sick. That we can't control. All we can do is best equip our teams with information, with the tools and supplies that they need to take care of patients, and some additional resources, again, like I mentioned, integrative medicine, meditation, things of that nature, where we've had great participation, and the folks who participate in it stays at tremendous help. So those are just some of the small things that we've been able to kind of lean on, within the organization, that really had a positive impact here.
Yeah, I think that's tremendously important. I mean, everybody in all roles is feeling especially beaten down, now a year into COVID. And so focusing on what you can do, the positives, the peer-to-peer work, the communication, you see on here the use of the technology, the informatics, what can you do to improve the efficiency? You can control some of that. The vendors, you can't control. The regulations and administrative burdens, you can't control. We can influence them. But the organizational attention, the programs, the communication, what we're doing to cultivate, an improved awareness and state of health and well-being within the organizations, and that translates down to the patients you serve. Those are elements we control. So that's great to hear. I'm going to just real quick go over some of the industry tools that are available for anybody who wants or needs resources to help the organization evaluate on an individual or a group level. We can make these available to anybody interested as well. Then I'll throw up a couple of closing stats and slides, turn it over for some additional commentary, and then we'll open it up to questions for Dr. Mendoza and Jesus. So you see here on screen, there are lots of industry standard tools available that do not take a long time. So if you or your organization is looking to really do an assessment, like I said, at an individual level or across the board, these are proven statistical methods and tools that are available for anybody to use to gauge where folks are at in terms of those definitive burnout patterns that we've addressed. And there's a couple other things, not just defining sort of where in the spectrum that they fall, but you see some peripheral evaluation tools here that can help with building resilience or evaluating resilience, which dictates and determines sort of likeliness to climb up the ladder of burnout, the hassle factors, how you interact with technology. So a number of tools available. One closing thought. So this has been a survey question from the Medscape national survey for a couple of years here. And really interesting, I think, to your last point, Jesus, what we're talking about, a lot of organizations still don't have dedicated programs and funds, to your point, Dr. Mendoza, around creating wellness or stress reduction or burnout prevention. So, you know, some don't know, and many, almost half, say, no, my organization doesn't have anything like that today. So a huge opportunity still out there. There are some who have cultivated and created programs and are sort of the early adopters and innovators. I look forward to the day where every organization, every healthcare entity has some form of program that works for their individuals at every level. And then the last slide, I'll turn it over to comments and closing thoughts. But on the clinician front, on the physician side, you see here across the board, 50% of doctors would gladly take today a pay cut if their life and job situation circumstances could be improved. So the time that they're spending after hours, the stress that they're dealing with, gladly 50%, 1 out of every 2 doctors you go and interact with would instantly take a pay cut. So I think that tells a lot right there in and of itself. Dr. Mendoza, Jesus, any last thoughts, comments here before we open it up to folks who may have questions for you?
Yeah, I mean, I think great points brought up. We talked about kind of the causes and what we could do to challenge healthcare organizations. This is, you know, it's not just for big healthcare organizations as well. Small practices, and someone mentioned on the chat about, you know, the actual healthcare IT workers too. I think there has to be kind of a you know organization wide, whether it's, you know, whether you have 10 people in your organization or 10,000 people, and how do you support that? You know, how do you support those the peer-to-peer? You know, at Baptist Health, we have chief wellness officers assigned at the highest level, executive levels, to oversee, you know, ongoing peer-to-peer programs, which is really important. So I want to commend them for that. But that's really kind of an evolution, and still it should be a growing department, because it becomes you know, integral to making sure you're providing the best patient care. But whether it's, you know, whether it's advances in technology, you know, don't interfere with the patient care and allow you to get, you know, back to basics in terms of patient care, or investments in the human care and peer-to-peer programs or wellness programs, it's something I think really should be budgeted and looked at every organization, whether it's 10 people or 10,000 people. But it's certainly it's here to stay for sure.
Yeah, and I'll add to it. You know, we briefly touched on these 2 points that I want to add, and someone kind of alluded to it in the comments. You know, at least from a nursing standpoint, taking everything into consideration, right? The patient surge, the acuity, the social media aspect, the news aspect. You know, this doesn't stop for healthcare workers when they leave the hospital. It's all around them. The constant reminder. And a lot of people have developed, you know, there's like almost second persona where they flip a switch. They have to flip a switch. I put a link in the comments about a very impactful video. It's about a 5-10 minute video. I really encourage you guys to watch it, about ICU nurses in Arizona and how they leave a shift. They got to turn that switch off because what they've experienced and endured during that shift, unimaginable. And they leave every shift wondering, you know, if that patient they're caring for, if they're going to be here the next shift, not even next week, the next shift. So that's important, you know, please check out that video. But taking all that into consideration, all those stressors, you know, we have a big issue with staffing. You know, you know, like any crisis, you know, there's opportunity. And in this in this crisis that we call the pandemic, there's been opportunity for a very lucrative opportunity for staffing agencies to where they have been recruiting nurses from early summer last year through current day and beyond, and it's pulling tremendous resources from healthcare facilities to where it's a staffing crisis. We're burnt out already from having to work extra shifts and so on and so forth. And now you're having to take on additional patient assignments because you don't have enough nursing staff, because, a nurse left for a contract in XYZ state for $120 an hour. That has created a violent cycle that nobody can control. People say, yeah, they'll be back. Yeah, they'll be back most likely. But in the meantime, people are struggling, and it's not Memorial, it's not South Florida, it's happening nationwide. Specifically, the areas that were hardest hit with COVID and stuff. So that's something I think that we need to really understand, realize that this is having a tremendous impact right now. And secondly, nursing students, healthcare facilities across the nation have shut down visitation, due to fear of continued infections and such. And in some places, such as at Memorial, we've limited student rotations, nursing student rotations. What that means for nurses entering the workforce is that, they unfortunately aren't going to have the same clinical foundation, knowledge foundation of a person who went through a regular nursing program. These folks are still going to school. They're supplementing their skills as best they can, but it's not going to be the same. So for all these nurses who've left the profession because of fear or whatever the case may be, they're being replaced by a new breed of nurses who are getting different training, right? Not the same level, unfortunately, through the pandemic. So just two of those quick thoughts, before we have a few more comments here and kind of have some closing remarks. I thought those are two very important items to kind of bring up that, it's not just COVID, but it's so many more things that are evolving out of it and continue to that we're going to feel the impacts here for a long time to come.
Yeah, thanks, Jesus. And I think, the sad and unfortunate part, I threw up a slide that, says now we are getting some good statistics on the nursing side, and we're at sort of that 25% mark. I think the unfortunate part is that we're going to see those numbers continue to climb the more and more it gets attention until, to Dr. Mendoza's point and what we said, until we get organizational commitment and funding and structures around combating it, culturally, and doing some preventive work within the organization. So unfortunate, I think there's a huge opportunity for a lot of organizations to really organize and get detailed about the ways in which they're supporting their staff around these items we've talked to. But all right, Nicole, I think we've got about 5 minutes. You want to open it up for any other questions? Is there anything in the chat that we want to address?
Well, going back, I think Kendall had one question. She was curious if the panelists had any recommendations for health IT to assist with clinical burnout.
Yeah, I'll jump in one thought right off the bat that I've seen and really over the last year come to the forefront, and then Oscar or Jesus and Dr. Mendoza, welcome your thoughts as well. With the rapid adoption of telehealth, I think it's become critical. I know in the providers I've worked with become a major annoyance, right? The technology itself, if it's not seamless, if it's not quick, it's been a contributing factor to burnout, to be perfectly honest. You think it's just an annoyance when you can't get the tablet, the link to work right away, but unless for some of those clinicians, unless you have IT support that can jump in real time to mitigate and to get that working, it is a giant pain. And so with telehealth now being everywhere, and I don't think that's going to change anytime soon, IT needs to be ready to jump in more real time, or it's just going to continue to be a burden and a stressor and a frustration point. And there are ways that IT departments can organize around that to do that in real time, but it takes work and it takes planning to make that commitment.
Yeah, I would agree. I can tell you that, for all the bad that COVID has brought. Silver lining, out of this is, adoption of things that have been in the pipeline, things that are very slowly being adopted. One of them is telehealth, right? So as physician offices closed down, as people were scared to go to the ER for minor care that they used ERs before, they had to find a new way to still have access to care, especially for organizations that have covered lives and things of that nature like we do. And so we had to exponentially ramp up our telehealth utilization. Fortunately, we were in a great place. We already had a very well-defined platform, so we were able to scale it very quickly. But there's organizations out there that had to start from scratch, or had to, whether they didn't have the capital to invest in the technology, or they just didn't have, a game plan. So we were fortunate that we were able to scale very quickly and really continue to provide service to patients through telehealth modalities, on a mobile platform. But that continues to be a struggle, and across organizations. So that's going to be interesting to see how that goes through legislation from a pay perspective, because there isn't parity there. So there's many different things that are going to be good coming out of this from a technology adoption standpoint, but it's still rough road ahead.
Okay. And Joseph had one comment to make. Joe, go ahead.
Sure. First of all, can you hear me?
Yeah.
Okay. Great, absolutely great conversation. There's three things that I'd like to add to the mix. Number one, we have to understand that the patient that you're talking to is as burned out as everybody else. It's not just the clinical side, is you have to realize that as you talk to a patient, and I spent almost 6 months in New York during the pandemic, it's not just the doctors, it's everyone. It's the firefighters, it's the police. And at one facility, what we suggested was to have a peer group, and the peer group was not just a peer group of physicians like Dr. Mendoza, but it was the firefighters, the EMTs, so that they could sit together and put together some strategy for that particular health system that addresses and I don't like to use the term burnout, I believe it is well-being. And there are companies out there that have peer coaches that's all they focus on. So as we all go through a challenging state, and it's going to get worse because this is now becoming a finance pandemic. It's not just COVID, as Jesus said. It is a financial pandemic. It's getting people back to work. We need to keep these things in mind. So I appreciate participating. You guys have been awesome.
Thanks, Joseph. I think we can all appreciate your comments. And, the unfortunate part is COVID specifically has probably rapidly accelerated the state of burnout or stress that other industries, other entities are going to be feeling. It's been a problem in healthcare for a long time, but other areas are now feeling it as well. And so your point around cultivating well-being is so critical.
Great
Yeah,
job.
I know we're kind of coming to time here. Joe, thank you for those thoughts. I think you're spot on, and I'd just like to add my last few words before we kind of share with Dr. Mendoza and kind of close this out. But at its core, we got to remember that we're humans. We need to lean on each other. We need to support each other. It's unrealistic, right, to think that anyone can operate under these without having some psychological impact. I don't think we're ready. The country, I don't think, is ready for the levels of PTSD, post-traumatic stress disorder, that are being seen already and that are going to be seen, once the dust settles from all of this. We need to recognize today that, healthcare workers have largely been, whatever role you have in healthcare, that those workers have largely been at the center of it all. And sometimes, getting back to your point, Joe, about the peer group, sometimes checking in on someone to see how their day is going, while providing some appreciation to what they're doing, will be enough encouragement and enough of a human factor to get them through their day. And after all, we all have to come back tomorrow and do this all over again. So with that, I want to tell everybody, thank you. I appreciate you. And I really enjoyed the dialogue today. I'm privileged to be here and have a little with a discussion with you guys, and I hope you found today useful. Dr. Mendoza?
Yeah, I want to echo those comments. Thank you very much. It does take a village to take care of any COVID patient, any ICU patient, any patient, period, when you get into any kind of healthcare setting. Okay, we all know that the team approach. And I think it's really important to look around to your peers or to your colleagues who may be functioning in a different role and say that they're your peers as well. Check in on them. This really does takes a community of colleagues to take care of each other especially in these times.
Absolutely. Thank you both. Really appreciate those comments. And I think everybody here hopefully can agree.
Great
Appreciate
job.
you guys joining. Nicole, anything else to close it out?
No, I think we're good. Thank you so much. And everyone, please check out the upcoming events and webinars that we'll have in the next year or in the near future. And I hope you have a wonderful rest of your day.
Thank you.
Thank
Thank
you all.
you.
Great day, everyone. Thank you.
Bye.
Well.